Good afternoon, one and all. Today, I'd like to talk on vitamin D and its effects on children, and especially what is happening to children who are not able to go out and play and missing out on sunlight. So, before I proceed further, let me talk a bit more about what is vitamin D and how does human beings get it. So vitamin D, although it's called as vitamin, it's actually a misnomer. It's a steroid. So plants, they contain something called as phytosterol, which we consume, or it can be available in food, fish, mushrooms, and comes to our body as D2, which then is processed further in the liver. Our skin also has huge amounts of cholesterol called as 7-dehydrocholesterol. When sunlight falls on the skin, sunlight converts these steroids into vitamin D3. Both vitamin D2 and D3 are processed in the liver to form activated vitamin D3, which again then is processed in the kidney to form 125 hydroxy vitamin D3, which is its most active form. Sunlight seems to be the best source for vitamin D3. A good exposure of even half an hour daily in a good sunlight, say in the morning between 9 to 10:30 or 11, can give people as much as 20,000 or 30,000 units in a single exposure. Foods, when eaten adequately, especially things like egg yolk, oily fishes, mushrooms, nuts, can give the daily requirement, which is 400 international units of vitamin D3. What does vitamin D3 do? It helps in absorption of calcium and phosphorus, so it makes the bones stronger. So if children are not getting enough vitamin D, they could have a problem of weaker bones. Weaker bones leads to easier injuries and more susceptibility to fractures. Vitamin D3 is also an immunity booster. There are ample studies which have been done which shows that whenever vitamin D was inadequate in the people, they had more number of episodes of colds and coughs, and especially during winter months. Vitamin D deficiency, especially sunlight deficient vitamin D, these people had more chances of getting colon cancer, Hodgkin's lymphoma, and many other forms of cancer. Vitamin D deficiency also had muscle pains, body pains in children. So, keeping all these factors together, we should ensure children get their adequate vitamin D on a daily basis. So, in newborn children, apart from breastfeeding, we doctors give a vitamin D3 drops which contains 400 international units every day to be taken once a day for 1 year. We also encourage parents to actively keep the child exposed to sunlight at least half an hour to 1 hour on a daily basis. In older children, we push the parents to give them adequate vitamin D rich foods such as egg yolk, oily fishes, mushrooms, and non-vegetarian foods if they are non-vegetarian parents. We also encourage parents to send these children out to play in the sunlight. Afternoons 4 to 5 is a good time, or if they are free in the weekends, morning again 9 a.m. to 10 a.m. is a good source of vitamin D3. At least 1 to 2 hours of playing in sunlight, exposing the children, is a very good source of getting natural vitamin D3. Thank you.